with MacDonald from Grand Lake Veterinary Hospital, and I'm just hopefully going to tell you a few things about your pet's upcoming dental and what goes into it and why. There's a lot of confusion about dentals, and lots of times people think that all we do is clean teeth, but it actually is oral surgery and a lot more than cleaning teeth. Dentistry can be really a little bit scary and a little bit confusing, especially when you get this estimate that has this huge range, and we're going to talk a bit about that. What goes into a dentistry, what happens before the dentistry, and why we can't always tell you ahead of time exactly how much that's going to cost. So a dental has been recommended to your pet, and we're going to tell you a bit about what goes into that. First off, you already most likely came in for an oral exam, and your doctor told you that something was going on in your pet's mouth and we needed to clean it. It's not just a cleaning though, because we are going to ultrasonically scale underneath all of the gingiva and try to get rid of all the bacteria and disease that is underneath the gum line. Before we do the dental, we actually are going to make sure that we have run pre-anesthetic blood work and evaluated that blood work and made sure that your pet is stable to go to surgery. We also are going to send you home with medication before dentals. And most of the time that medication is going to include a pain medication and an anti-nausea medication. The pain medication is great because it doubles as an actual anti-anxiety. Once your pet gets here, we are going to give them some more pre-meds here so they're less stressed, and then we're going to put an IV catheter. All of our patients are monitored with an EKG that measures their heart rhythm and shows that rhythm that you're used to seeing. They're going to be measured with a pulse oximeter that helps measure their oxygenation status. They're going to be measured with an end-tidal CO2. That's actually an anesthesiologist and our favorite piece of equipment because it tells us real-time how well your cat is oxygenating. And we actually have really nice, fancy bear huggers that help keep your patient warm while they're under anesthesia. We have dedicated staff that are just monitoring your patient while they are under anesthesia, so the people who are cleaning the teeth or taking the x-rays or developing the x-rays are focusing on those things, while one person is dedicated only to monitoring your pet's needs while they're under anesthesia. Now, in that pre-anesthetic appointment, we generally can give you an idea of how bad it looks, but we get caught by surprise with some frequency. In part because there are actually quite a few teeth in the mouth we can't actually see well in an awake dog. Once we take x-rays, we're going to evaluate those x-rays, and I have some x-rays to actually show you that tell you that there's a lot more in dentistry than just cleaning teeth. So here's an x-ray of normal teeth, and what you're seeing is the big, huge lower molar. You're going to see a lot of pictures of this big, huge lower molar. It's one of our favorite pictures that we put up because it's actually one of the most important teeth in the mouth. And this is all the bone of the jaw. And the bone of the jaw in this x-ray is showing the bone goes all the way up to the crown of the teeth. This is actually all looking really good on this patient, and that's a pretty healthy mouth. And while we might have sent this patient to dentistry to clean their teeth, we're trying to make sure this horizontal bone stays really high. Now this is what we might see when we take x-rays. We might see that the horizontal bone, instead of coming all the way up here to the crown of the teeth, is actually recessed. And that's actually not great. In fact, if you have more than about 40 or 50% of bone loss, that's an indication of pull teeth because we know that the tooth is actually going to fail and potentially be painful. This is actually a really good x-ray too that shows a really important thing in the lower part of a pet's mouth, which is this huge mandibular canal. That's actually a tunnel running through the jaw, and in that tunnel runs a very, very important artery, nerve, and vein, and we do not want to hit that. But we take x-rays because we need to know a few things. We need to know if both teeth are abscessed, if both roots are abscessed. In this case, this part's going to come out pretty easily, but this part's actually still fused to the jawbone. And in order to get that tooth out, we're actually going to drill quite a bit of bone away to be able to wiggle that tooth out. This is another x-ray of, again, favorite tooth, that lower molar. And this is a small breed dog, I know, because there's actually not much bone between the bottom of that root and the bottom of the jaw. And you see an absence of jaw here. This is actually a fractured jaw from this big lower molar being abscessed. It's one of the reasons we care so much about our lower teeth, is because they not only can cause pain when they're uncomfortable, but they actually can cause the jaw to fracture, which we really don't like. It's also why we take a lot of time and skill to pull teeth, because in this case the abscess has fractured the jaw, but both our lower molars and our lower canines, if we don't extract them carefully, have the risk of causing jaw fracture. So we are really protective of protecting these lower teeth and trying to make sure that we're very delicate when we extract these teeth. This is the upper teeth. This is the big upper chewing tooth. It's the one that's actually opposite that big lower molar we've been talking about. And this big huge black lucency, that's actually a tooth root abscess. And that's even though the upper part of this tooth looks like it's completely healthy, it's actually one of the main reasons we take x-rays. I always say that teeth are like icebergs. You don't know what lies beneath. In fact, many times what was below the gum line is much larger than what's above the gum line, and we are taking these x-rays to make sure we don't have abscesses. One thing you can also tell from this x-ray is that some teeth have 2 roots, some teeth have 1 root, and some teeth have 3. These are 2 of the teeth that have 2 roots. This tooth actually has 3. 1, you can't quite see that there, 2, 3, and 1, 2, 3. So those 3 teeth are anchored in to be able to withstand 3,000 pounds of pressure per square inch. What I tell people all the time is my wrist does not have 3,000 pounds of pressure per square inch power. And so in order to actually pull this tooth, we are going to do a gingival flap, and we are going to burr away bone. We are going to cut this tooth into 3 parts, and we are going to wiggle each part out in full so that we don't leave any bone behind. In this case, this is the tooth root, and there's almost no bone. You see something else that I love in this picture too, which is in this small breed dog, this tooth root hooks. And it hooks in that huge canal that we talked about earlier, has an artery, nerve, and a vein. That's what we cannot hit. One of the reasons we take full mouth x-rays is to know what is abscessed, but the other reason we take full mouth x-rays is to know what we should touch. This is the type of tooth that we as general practitioners would actually refer to a board certified dentist, because we don't know if this hook actually hooks on the outside of the jawbone or on the inside of the jawbone, and you actually ideally get a circular CT to figure that out, because you can't cut this tooth like a normal tooth and wiggle this bone straight out. It has a hook on it. You actually have to come in from the side, and when you do that, you have to know if you come in from the inside or the outside, because you have to miss that artery, nerve, and vein. So when we do dentistry here at Grand Lake Veterinary Hospital, we anesthetize our patients, we clean their teeth, we take full mouth x-rays, we assess those x-rays, and then we decide what teeth are either causing discomfort or have abscess or need to be pulled. Now our hope is to do all of this work and get all of these painful teeth out, and then give you the tools to not have to do dentistry often. After we clean your dog's teeth, we are going to send you home with pain medication if indicated, antibiotics if indicated, and instructions for post-anesthesia and post-op care. If you had teeth extracted, we're going to schedule an appointment about 2 weeks out to look at those extractions. Now those sutures that we put in, those are actually going to dissolve on their own, but we want to make sure that the wound itself is actually healing. And we're going to want to make sure that after you do all of this care for your dog's mouth, we give you the tools to make sure you can try to maintain it in a whole variety of different ways. Lots of times that's going to be chewable treats, sometimes that's going to be water additives, sometimes that's going to be algae, sometimes that's going to be brushing teeth if you guys can. Now, from a practical perspective, the single best thing you can do for your dog's mouth is brush their teeth every day. Are you going to do that? Well, a very few dedicated clients are. I've been practicing for 22 years. I think I'm up to about 17 clients in 22 years that actually brush their dog's teeth every day. So we know that's a big challenge, but what I love for my clients is doing something for their teeth at least 5 times a week. Maybe that's a treat. Maybe that's brushing their teeth. Maybe that's doing the water additive or the plaque off that day. But if you can do something for their teeth, you push out the number of dentals they have to have in their lifetime. After surgery and your pet goes home, they're often going to be groggy for a couple of days. I always say that my dogs aren't annoying again for usually 2 days, even after a routine anesthesia with no extractions and nothing that was actually painful. However, when you go home the night after surgery, it's always shocking how much dogs usually will eat. Now, it's really nice if you had extractions for you to soften the food, and we usually will tell you to soften their food for about 3 to 5 days, maybe a bit longer if you had a lot of extractions. So softening the food is one nice thing to do, and making sure they have a quiet place to rest, to sleep off that anesthesia is great also. One of our staff will call you the next day to check in, and if you haven't heard from them in the morning and you're worried about anything, please give us a call back and let us know that you're worried. We are always happy to make sure we recheck a patient and make sure everything is going well and you have all of your questions answered.